Hey everyone, Dr. Adam here with another weekly wellness video. And this week we're doing a request. I had some patients ask me about calcium supplements and just generally what I thought about them as far as helping with preventing osteoporosis as well as just for general health reasons. And this is going to be a two-part video. We're going to make another video to kind of go along with this one. But in the 6 years that I've been doing functional medicine and clinical nutrition, I have never prescribed a patient calcium supplements, and that's for a few different reasons. One is I'm a big fan of people getting their calcium from dietary sources, and really that's what the research has shown is we're just much better off getting it from the food we're eating. Another reason is, there's really no good research out there that shows that taking calcium supplements is going to do anything to prevent osteoporosis, prevent fractures, or basically build up strong bone. There's just really not any good research that shows that. In fact, there is some mixed research out there that has shown that too much calcium supplements, and especially the really cheap synthetic kind, too much of that will actually increase your risk of cardiovascular problems and heart problems, as well as if you've got a bunch of cheap synthetic calcium going through your system that your body's not using, that will actually help contribute to things like kidney stones, gallbladder stones, and things like arthritis and bone spurs. So once again, I'm just not a huge fan of prescribing calcium supplements to try to prevent osteoporosis or anything like that. Now, what people have to realize is calcium is not the magic bullet for preventing osteoporosis or rebuilding bone. That the whole rebuilding of bone concept is a very dynamic process, and a lot of little factors will go into that. You also have to realize that your body needs other things like vitamin D, vitamin K2, and other types of trace minerals for it to really start to rebuild the bones if you are dealing with something like osteoporosis. Now, another thing is, and once again, most people don't want to hear it, but what you're eating and your dietary habits also play a huge role in whether or not you're going to develop osteoporosis to begin with. Because if you're eating a lot of processed foods and sugars and soft drinks and things like that, those types of foods tend to create a very acidic environment on the inside of your body. And in order for your body to neutralize that so you don't die, your body is going to start pulling calcium and magnesium out of your bones and out of your muscles in order to neutralize the acidity so you can keep living. But at the same time, though, that's going to create the weaknesses, and that's going to create osteoporosis and the weakening of your bones by that process. So it's just as important to try to prevent osteoporosis just by eating a clean anti-inflammatory diet. And actually on the next video, that's exactly what we're going to be talking about. We're going to be going through some specific types of foods and other things you can be putting into your diet that's going to help as far as building stronger bones and rebuilding bones if you have osteoporosis. Now, another thing that is really been researched well as far as preventing and helping osteoporosis is just general strength training. So that's why the Be Strong for Life program that Dr. Brenda has been doing here for a while, that's why that's such a great program for people who either want to try to prevent osteoporosis, or if you already have osteoporosis and you're trying to do something to make those bones and muscles stronger. The Be Strong for Life program is fantastic. If you already haven't talked to Dr. Brenda about that, I highly recommend you talk to her about it if that's something you're very concerned with. So all in all, once again, I'm just not a big fan of calcium supplements in general. If you are going to take a calcium supplement, you want to try to make sure that it's basically derived from food. You don't want some cheap synthetic type of calcium. And if you have any questions about that, just grab myself or Dr. Brenda. And we work with certain nutrition companies out there that utilize whole food based types of supplementation, like calcium and magnesium and those types of things. And it's actually derived from foods instead of just synthetic chemicals and those types of things. So once again, keep a watch out. We're going to send out the follow-up video where we're going to be talking about some of the more specific types of foods you can start getting in your diet that are going to help bring in more calcium, basically more bioavailable calcium that your body's actually going to be able to use in restoring bone strength and calcium into your system. So anyways, hope you guys learned something today, and we'll talk to you soon.